All right, so our next topic is going to be head and spinal injuries. So we are in your book on page 23. Okay.
That's what I just had, and you killed me. What? That was a bystander.
All right. So quick anatomy lesson for you. Your brain and your spinal cord, I'm not going to read all this, make up your central nervous system. They coordinate your walking, your talking, your thinking. Pain receptors are all there. So those body parts, your brain, your spinal cord, very highly specialized tissues. So specialized that if they are injured, they actually cannot regenerate themselves. Okay, which is why these injuries are treated above and beyond, right? Even if we suspect head spinal injury, we're going to keep them immobilized and we're going to call 911, right? There's no way us as first aiders, we're going to transport them safely to the hospital. We'll need a spine board, neck brace, okay? And then a slow drive to the hospital, okay? The autonomic nervous system is another part of your body. You do not think about this. It's all controlled by your brain. This includes your involuntary body functions, such as your heart rate, breathing, okay, body temperature, and digestion. Okay? So on the next page over, what are some common causes? I know they're in your book, but what are some common causes of a head spinal injury? What situations would you suspect this person's having a head spinal injury? Yeah. Sports is one of the bigger ones. Yeah. Yeah. Car accidents. Okay. Falls. Okay. Even as you get older, bone density decreases. Even like a fall, ground level fall from the ground can cause serious injuries. Right. Diving accidents. Okay, so head spinal injuries, you might have one sign and symptom, you might have, all of them. So common signs and symptoms of head spinal injuries include unresponsiveness or altered in their level of response. So they may not be responding appropriately. They might have pain or pressure in their head, neck, back. Okay, loss of movement or tingling and numbness in the extremities. So just because they can't feel it right now doesn't mean that's permanent. Okay, it could regenerate and it could heal, and they can, have those sensations back. So if they're panicking, just try to keep them calm, reassure them that help is on the way. Obvious bumps, deformities, bruising on the head, blood or clear fluid coming from the ear and nose. Remember what that fluid's called from yesterday? Cerebral spinal fluid. Yeah, that's a shock absorber in your brain. It's cushioning your brain every day, so when you're walking around, you're not getting head spinal injuries. But when your brain starts to swell because of an external injury, that spinal fluid has nowhere else to go. Your skull is not expandable. It gets pushed out your ear and your nose. Okay, so yeah, that's what that would be. Nausea, vomiting, you're going to see that with a lot of different injuries in the book. Breathing, vision difficulties, unequal pupil size. So one pupil may be very, very small and the other one might be quite large. Okay. And then severe headache, of course. Okay. So our treatment of head spinal injuries, we're always going to go back to our stop. Okay. So we assess for hazards, we introduce ourselves, we activate EMS. Okay. And then we're going to try to keep the casualty as still as possible. Do make sure you don't sneak up on them, because if you're coming from behind them and they're looking this way, what's going to happen when you start talking? They're going to turn their head, right? So one of the first things you should say when you suspect a head and spinal injury is just, don't move, please. My name is, I know first aid. Can I help you? Okay. And then we immobilize the person, fill in the blank, in the position they're found in, right? We're not going to move anything. We're not going to, manipulate anything. EMS, they want to do it once correctly, right? It's in your book on page 24. I know, there's a lot of worksheets here. So we're going to mobilize them in the position found, okay? Now, this is if they're talking to you and they're responsive. So we'll do that first. If they're unresponsive, it's, essentially what we did earlier. We check for breathing, we activate EMS. Okay. So while we're waiting for EMS, we're going to help stabilize, that's number 3, the head and neck until EMS arrive. Okay. Bystanders can help you do this because you're first aid trained. You can do a little bit more, like treating injuries, right? And then as someone's holding onto their head and neck, we're going to perform a secondary assessment, if appropriate. you can provide first aid to control injuries like bleeding. Okay. Number 5 is continue to reassure the casualty, treat for shock. Okay. So keep them warm. Okay. So there's 3 different ways. There's 3 pictures in your book here on page 24 to immobilize someone's head and neck. Okay. So the first one is in a vehicle. Okay. So you can see that vehicle. The first aider is in the back seat. Okay. They ask permission first, and he's immobilizing the injured driver in the position found. Okay, so you're going to spread your fingers as wide as you can, and you want as much surface area on them as possible. Okay, you want your forearms anchored onto something that's not moving. The back of their seat would be ideal, because you don't want to be shaking. Right? You're gonna hold this position for quite a long time, so you don't want to be moving around. Okay. And yeah, then you can go through your questions. If someone else is available to hold them, feel free to borrow them. So I need a volunteer. Okay, thank you. Okay. Okay. Can you just sit right here?
Why?
Okay.
Really matching.
This is so awkward. Okay. All right. There we go. So he's in a vehicle. I see this. I approach from this angle. Please do not move. I am Virginia. I know first aid. Please answer with your voice only. Do you have any injuries?
Yes.
Yes, your neck hurts.
Yeah.
Sir, please call 911. This person's just involved in a vehicle collision. I'll update you for injuries as you're on the phone. Okay? So, may I open your back seat and
Yes.
get inside to help immobilize your head and neck? Right, here are my gloves. Okay, so I'm going to just keep your head still. I want to immobilize you in the position found. Okay, so you're going to feel pressure on the sides of your head. Okay, so I anchor myself first. I get myself comfortable first. Okay, so make sure you don't cup the ears. They want to be able to hear still. So now we go through our secondary questions. Okay, we monitor vital signs, and then we do a head to toe check. Okay, waiting for EMS to arrive. Thank you. Okay, so let's practice that one really quickly in your groups of 2.
Thanks.